Individuals who are South Asian have a much higher risk of developing cardiovascular disease. There's a 40% higher mortality rate from cardiovascular disease among South Asians compared to the general population. According to the World Health Organization report, the South Asian diaspora comprised 25% of the world's population, but will suffer over 50% of the world's cardiovascular-related deaths. At this point, you might be wondering why South Asians have a higher rate of heart disease. While more research is needed, there are certain factors that contribute to higher rates of heart disease in South Asians worldwide. South Asians tend to have more visceral fat, which is fat that surrounds internal organs where it should not be, such as the abdomen and liver. This causes more metabolic damage than subcutaneous fat, which is the type of fat that can be seen. Even South Asians who have lower BMIs have a higher likelihood of having cardiovascular disease. This risk is often overlooked by providers because the patient's BMI is not high. For example, many South Asians have diabetes, another risk factor for cardiovascular disease, even though their BMI is considered normal. If a doctor only looks at BMI and not other indicators such as diabetes, many South Asians are overlooked and may not receive help for their heart disease soon enough. A study has shown that South Asians have smaller coronary arteries than other groups, which could possibly be the reason for higher rates of cardiovascular disease. The Masala study aims to explore behavioral, social, cultural, and clinical risk factors for South Asians. There are very few studies that are focused on South Asians long term. As a result, a lot more research is required to find effective strategies to improve heart disease prevention and treatment in the South Asian population. Check out our other videos on how to participate in clinical trials and steps you can take to improve your heart health.